Welcome back to the Spotlight series, where we highlight entrepreneurs in the Yale community. Today we are lucky to be joined by Soleil, who is a VC fellow at age1, a biotech and healthcare venture capital fund focusing on innovation in the longevity and biotech space. Soleil, thank you so much for joining us today.
Thank you.
So just to start off, could we talk a little bit more about your background and your interests and what led you to really explore the biotech and healthcare space?
Yeah, so I think I've always been interested in biology, probably ever since, fifth grade. I think it started with neuroscience. I think I was first really interested in the brain and, how my own brain worked, of course, played into that. But then I just became more fascinated with biology in general. So I joined a lab in ninth grade. For context, I'm from New York City. So I joined the Icahn School of Medicine, which was, really lucky to be like a 5-minute walk away from my school. So I could just go to the lab every day after high school for 3 years, apart from like girls varsity tennis season I was at the lab. And there I worked on a lot of projects with, endocrinology, metabolism, pharmacology, kind of the intersection of all those things, a little bit of neuro even. But I really enjoyed all of it. So that's my background's really in research. And then kind of coming into venture, it was, I think, the December of my senior year where I started to think about, how else to apply my love for biology and critical thinking into kind of a space outside of the lab. I think, I kind of realized that since ninth grade, the only way that I've ever been exposed to biology as being a part of my career is, as an academic. I was always set on getting a PhD, becoming a professor even. But then, I'm not even sure like what the catalyst was, but I think I just had this idea that like it would be good to try a different way to use those skills outside of the lab and see if that was something I was interested in. And so after, getting into college early, I cold emailed really a lot of VC funds, and one in particular stood out to me, which was age1. And is really, I think I saw a TED Talk by one of our GPs, Laura Deming, whose story is absolutely incredible. So Laura Deming, for those of you who don't know, she came here from New Zealand at the age of 12 to work with Cynthia Kenyon, who's really a leader in this longevity aging research space. She got into MIT at 14, dropped out of MIT at 15 because she got the Teal Fellowship, a $100,000 grant to, do whatever she wanted with. So she used that money to, do this first experiment in longevity biotech venture, which was very successful. And that's kind of what she did since then. And so age1 is kind of a really, a lot of twists and turns along the way, but really kind of a continuation of this longevity fund idea and thesis. And so I was just so inspired by that story. And I thought, I must like shoot my shot. So although all the other funds that I only mailed were based in New York, this one in San Francisco, I just thought, have to see what I can do for them. And got no responses for a month from any of these. And so I was like, okay, I'll just like do research over the summer. That's fine. Then a month later, I get, a response to my email from the head of operations at age1 saying, to set up a call. And so I did. And the rest is history.
Wow, that's amazing. Yeah. And just to talk a little bit more about age1, so could you describe a bit more about their vision and mission, maybe taking more of a top-down view and what they specifically are looking to invest in the biotech and healthcare space?
Yeah, so age1 invests in founder-first companies that are developing technologies and therapeutics in the longevity biotech space. So anything that, any company that has the mission to extend longevity and more importantly, health span, whether that's through, neurodegenerative disease, cardiometabolic disease, muscle, bone, any kind of disease of aging or any kind of consequence of aging biology that we see in the human condition or, targeting mechanisms of aging itself even, will invest in, founders who are pursuing that mission. And I would say that's our main thesis.
Yeah, it's really cool to hear about. And just, again, from a top-down view, this might be a very simple question, but why do you and why does age1 think that the preservation of a healthy life is something that is important and really should be pursued?
Yeah, it's a really good question. It's something that I think everyone on the team at age1, and what I really love it there is everyone really does have their own reason or their own passion for, getting interested in aging and this field. I think for me, it kind of comes from a lot of different places. I think one is just a large interest in the biology. I don't know if anyone, is familiar with this, but I also in high school was listening to podcasts like Peter Attia, was a big one for me. Like he's a big figure in this kind of longevity science space. So that work always just interested me. I never was really interested in like the rare diseases, like, cancer or like, not that cancer's a rare disease, but, like rare cancers or, autoimmune diseases or things like that. I was always interested in like these big diseases like muscle, bone, adipose dysfunction, metabolic dysfunction, neurodegenerative. And so I think that's where kind of partly my interest comes from. The other side, and really why I think like this side kind of ties more into why everyone should be, interested in living, a healthier life, I think it really comes from a personal side. My grandmother throughout high school, and this is something that, dealt with like since ninth grade in my laboratory experience, was in ninth grade, she was diagnosed with dementia. And I think that really took from my family and kind of just like seeing how that takes over a person. And I think it was also kind of seeing how aging as a process is very like multifactorial, because as, we saw her brain function deteriorate, her physical capacity could also deteriorate, right? She couldn't move as much. She lost, like function in terms of like mobility, right? Obviously, starting to develop sarcopenic obesity and metabolic dysfunction. And so kind of all these things accumulating with old age. She suffered a hip fracture earlier this year. And so, there you got to see like, how even bone fragility, like post-menopause, and how all these things tie together from like neurodegenerative, cardiometabolic deterioration, bone deterioration, and kind of just seeing an elderly person in that state, you really gain this appreciation for like what, like no one should have to go through this, right? Like, I know that when I die, frankly, like I want to be myself, and that, I want to have full physical capacity, full mental capacity. I want to, feel like I'm present with my loved ones in that moment. I want to feel like, I can remember my life and feel fulfilled in that moment. I think we all wish, we had more time, right? But I don't even think it's so much about time as it is, again, this healthy lifespan and like health span. And this, we can talk about like even, this differentiation between health span and lifespan. But I think this idea of, living healthier so that in those later years you have dignity, you have autonomy, you have independence, you don't feel like you're, a burden to anyone. I think that's something that's so important to me as I grow older, and I would assume is important to anyone. Yeah, I think those are my main reasons for, why we should live healthy. I think if anyone is interested, they should go to a nursing home and see what that's like. And yeah, that would be my main advice.
Yeah, that makes a lot of sense. And just over the course of my research, I heard a lot about age1. You mentioned Laura Deming. She says that we are currently in an inflection point in terms of biotech and healthcare. And I just want to hear about your perspective on that. Do you think we are at an inflection point in this space? And if so, how come?
Yeah, I think so. I think there's quite a few reasons for that. I think one, you kind of just see in the population, right? I mean, I think 1 in 6 people are estimated to be over the age of 60 by 2030. So that's, a huge impetus for like, people are going to be in higher demand for these therapeutics that will extend their healthy lifespan and make sure that they're healthy in those years. I think on the technology front, right, technologies like RNAi, right, or silencing RNA, or, brain shuttle for neurodegenerative disease was a huge breakthrough in the last decade or so. So even like gene therapy is now becoming, more of a accepted like potential practice. Things like epigenetic reprogramming, right? These, technologies that, 2 decades ago were kind of just this eccentric science. Now we have like Yamanaka factors, and, there was one who won the Nobel Prize for this, right? You have people at institutions like Yale, right? Like YAGE, the Yale Aging Research Center run by Dr. Dixit, that's doing incredible work in aging. And so when aging was once this kind of fringe pursuit, that was something that, was like, eccentric scientists might have worked on. We now have, major research centers at, Harvard, Yale, Stanford, like all of these, Scripps, all of these major institutes that are seriously working on this question with some of, some incredible faculty. And so on that side, not only on the technology front of, brain shuttles, RNAi, and tissue-targeted drug delivery, but also kind of just a general societal understanding that this is actually a legitimate field. I think that's becoming more and more accepted. And then on the regulatory front, too, this is actually a company that was incubated and funded by the Longevity Fund, Laura Deming's previous venture. Loyal is the company's name. They're developing longevity therapeutics for dogs. And they had a really massive breakthrough just a few years ago in getting FDA approval for really a lifespan extension drug for dogs. Wow. And that had like never been done before. Like there was never a pathway in the FDA for like a drug that could extend one's life as, this aging as an indication. Mm-hmm. And so that's a massive breakthrough, one small step for like dogs and, like for man is the end goal, right? So we're getting closer and closer to developing a regulatory framework for actually getting a drug and for aging approved for humans. So I think all those things like technology, the kind of more broadening acceptance of longevity and aging as a legitimate field to study, as well as the capital that's being put into aging recently, I would actually add. And what was the last one? The regulatory landscape. I think all those things together are what kind of Deming means when she calls this an inflection point, and I wholeheartedly agree.
Yeah, I mean, thank you for breaking it down so clearly. I want to focus a little bit more on the technology side, and I guess, explaining it to people like me, non-science majors, Could you explain specifically what the technologies that age1 works with?
Yeah.
For example, just doing some research, I was looking at how age1 compares what is traditionally more like small molecules versus the modalities that they focus on, which they include such as biologics, cell therapy, gene therapy, and tissue engineering, maybe just breaking them down at a very high level.
Yeah.
Could you explain those?
Yeah, I mean, I'll add that small molecules, these are just, molecules that are, synthesized in laboratory that are very, they're the kind of the most common drug of, we would say, the past, and they're still used. Small molecules are still very efficacious in many indications, like, cancer and really, I think like most Tylenol, Advil, I'm pretty sure of small molecules, right? Small molecules are everywhere, and they're very easy to produce, very economically efficient. And so that is kind of just the preferred modality of pharmaceutical companies for a really long time. And then these kind of new methods you're talking about, like biologics, I think that one is a little bit more, that's the first kind of step forward where we're talking about antibodies. And so kind of, I think antibodies are probably the best known biologic in the idea that, we have antibodies in our bodies already. And so the idea is to actually synthesize antibodies like in a laboratory setting and kind of use your body's own like antibody like immune response, but like use that kind of same technology to target something. Antibodies, right? Like, any kind of drug that can attach something, right?
Yeah.
And then I guess when we talk about these newer modalities, right? I think the ones you're probably referring to are, I would say epigenetic reprogramming is a big one, and that's kind of like a big leap forward from biologics. But that's one that companies like Retro Biosciences or Altos Labs are developing. So Retro Biosciences recently, famously in a collaboration with Sam Altman's OpenAI on protein design. Altos Labs, famously funded by Jeff Bezos. So those are ones that are doing what's called like epigenetic reprogramming, which is kind of taking a cell and using what's called Yamanaka factors to basically reprogram the cell into a different state, right? So if we have, certain markers of a cell that are aged per se, you can modulate these factors, these Yamanaka factors, to change the state of the cell, even back to a stem cell, if you wanted to, perhaps. Some other methods, interfering RNA, small interfering RNA, or siRNA, or RNAi, however you want to say it. I think that's been a big one as well, the idea that you can have a molecule that can attach to a pathogenic RNA and then just silence it, as in the name. I think that's been a really powerful technology that's getting, more and more specific with more technological advances. I think those would be the big ones. I think there is, a case for AAVs, like viruses, as technology, but I think that those are still, have a lot of safety issues involved, and so they're not as referred to, something like siRNA, which is actually quite safe, I would say, at this point in time. Cell therapy is another one, right? Like Parkinson's, I think, is one where cell therapy has great potential, and that we're really excited to see progress in Parkinson's being made through that modality. And then I think even something that age1 is really interested in now is BCI, or brain-computer interfaces. The idea there being, motor function, right, is obviously something we lose with age. And yes, would it be amazing if we could cure that with, a therapeutic? Yes, but if you could also, kind of cure that same pathology with a brain-computer interface, that would be really interesting. So we've recently been kind of looking into that space, which has been really interesting. I'm certainly not I don't consider myself a very technical person, but learning about that BCI space, that just goes to show like the extent to which, we consider technologies that can in any way improve a person's health span.
Very cool. Yeah, thank you for explaining all that. And now just moving a bit more into the VC side of thing, the investing side of thing, could you give some insight into the work that you've done so far as a VC fellow with age1, kind of what the day-to-day looks like, what kind of work do you do, and how would you describe the firm's, their processes?
Yeah, so over the summer, I worked as an venture intern at age1, and in that role, my primary role was actually content writing. And it was actually a really interesting story. Like when I first, was interviewed with age1, I mentioned, like, I know you guys have a Substack, and I saw that, you guys haven't published anything since 2024. I was wondering if, like, maybe you guys needed someone to publish on the Substack, and, they seemed, like, really enthusiastic about that idea. And I love writing. I mean, in high school, I was, like, editor-in-chief of my school's literary magazine. I did scientific writing. I was always a writer at heart, so, like, this seemed like the perfect kind of match. But I'll be honest, when I first started writing for age1 and, like, Substack, I had this very big fear that, like, no one was going to read my work, that, like, media was dead. I was honestly, kind of under that impression, which I think is, like, a very kind of cynical but, like, very widespread idea in the current age. And, I first published this article that I spent, like, a month and a half working on ranking pharma companies in aging, so big pharma like Eli Lilly, Novartis, Novo Nordisk. And, I published it, and I was like, no one's going to read this. And then it ended up getting a lot of attention, actually. And by like farm executives and things like that, and like founders, people would reach out to me. And I realized like media's not dead. Like it was actually so that was like my first really interesting experience with age1, realizing like how content can actually make an impact and how like content can build age1's brand. So that was one like really cool experience. And I did a few other articles for them, and I'll probably continue to do some short form. But obviously now as a venture fellow, as a venture intern, I still did contribute to like diligence and projects like that. Now as a venture fellow, I still more kind of do some diligence as well as, founder calls and some, I would say like special projects that we have going on. But I think my favorite part of the job has actually always been like portfolio support as well. So, in age1's portfolio, like we care, as I said before, like very founder-led companies. And so that's something I've been like really passionate about. Like the founders that we work with are just so brilliant, so charismatic, and just a joy to work with and like advance their mission. Obviously, when we invest in them, we already have so much conviction in their mission that to actually be able to help them directly with, say like a founder wants to, have some competitive landscaping done for their asset, or wants to know, hey, can we use our similar technology that we're using for this asset in a different indication, right? And so doing research on that for them, that would be part of my job, and I always really enjoyed that. So that's what I would say, on a broad overview, what day-to-day looks like. Of course, during the summer, I worked full-time now as a student. I can't do that, unfortunately. But even kind of the time that I do get to spend part-time working has been a joy. The team is absolutely amazing, and I can't say enough good things.
Yeah, it's a lot that you've given us so far. Actually, I want to focus a bit more about the media side of things and your work with that. And I'm very curious in how you think, you talk about age1 having a Substack, how that really helps. You talk about building their brand for marketing. Are there any other uses? And what?
Yeah, I think one is especially, just bring attention to the aging field in general. I think it's something that age1 always, we talked about like a talent bottleneck in the aging space, and how, we have a lot of the tools and technologies actually to like move us forward and like add years to life. And the big, thing we need to do is just like bring more talented people into the fold. And so content like this, I think, also, just exposes people to like, they see this article in their subject, like pharma and aging, like what does that even mean? Read this, maybe just sparks their interest in like the aging field. I think another, way, obviously, right, is like to, as a way of sourcing, right, kind of bring attention to the brand, makes more founders interested in potentially having age1 as an investor, brings us more attention in the VC space, and just kind of as, like the brand in longevity investing, right? I think that's something important to like. age1 is like being known as like kind of a very science-first investor in longevity, especially like with how the field, is perceived by many as like eccentric. And so having these very like science-forward articles is important. So like this accuracy and like being a source of truth in this like aging space, where again, there are so many players who, have this like, again, more, to put it bluntly, like kind of snake oil kind of in the field, right? There's a lot of that, and like drugs that can like extend your lifespan by 200x, whatever. So I think that's a big point of the content as well, like putting out accurate, source like information out there about the aging field and like what's new and getting people excited about this field. I think that's something that content has been really powerful in.
I think content really is a very underlooked part of, just the marketing in general for these VC firms. I want to move to now talking a bit more about the working dynamics. I know age1 is, generally a smaller team, but I want to hear from your perspective what you think that brings as experience for you and how that really benefits the team. Any kind of mentorship, and what are the biggest lessons learned from that?
I think the best thing that I've gotten from age1 is just like the mentorship and like the one-on-one connections that I've had with the people. I can't say enough like good things about working with a small team, and I know that's something that I'd probably want to take forward. I can also see myself working for a bigger team within, a smaller group or something like that. But I know that definitely thrive in small teams. And just, having that one-on-one mentorship and camaraderie like within the group, being, all present together on diligence calls, or, everyone gets their say, right? I think that's something really powerful about working on a small team, is that no matter kind of your place in the team, age1 is like very meritocratic. And it's always about, like, what do you think? Whenever something comes to the table, they want to get everyone's opinions. And because you have a small team, you're able to do that, right? In a bigger team, sometimes you're not always able to get everyone's input on a company or like an investment or on a special project. But with this kind of small team and having these meetings like all together, you really do get everyone's perspectives involved, as well as, especially for me, like being the youngest on the team, having that mentorship from, Alex, our GP, who's an incredible person, and Saavedra, who's a principal, Kat, I can list everyone at the team. Like, they're all such amazing people. But, their mentorship has been truly invaluable as I, think about, what am I interested in biotech and, how I can contribute to the field as a, even an undergraduate student.
Yeah, it's really great to hear. I want to move now to talking about the founders that age1 actually invests in. And when reading up about this firm, I saw a lot that they describe them as contrarian.
Yeah.
So I want to hear a bit more about, what this description really means and maybe other traits and other qualities that age1 really looks for in founders.
Yeah, I think one thing that we really look in founders is mission driven. It's really that aging alignment, right? I mean, that not only matters to age1, but also our LPs. And so that's really important to us. I think as for contrarian, I think anyone who really works in aging and makes themselves explicitly aging centric is contrarian in today's world, right? If you're not really chasing an indication, that already makes you somewhat contrarian. I think anyone who works in the aging space is a bit contrarian by nature. So I think that actually hasn't been as much of a focus as it is kind of just something that we found to be a pattern in this space. But yeah, people who truly are willing to launch these what we would call moonshot projects, basically, right? Projects that are a bit more maybe high risk, and of course every risk is measured, but are a bit more high risk, are more ambitious, but as well measuredly ambitious, right? That they're ambitious, but have a timetable and have a scale on how they're going to achieve that ambition. That's what we look for in terms of contrarian. And God, what was the other part of the question?
That's pretty much it. Contrarian and what the qualities and traits.
Yes, and qualities and traits.
That we look for.
I think definitely just passion is probably the biggest one.
Great. Now, to all the founders out there, or prospective founders, I know that age1 invests a lot in early stage companies, and they make the claim that they find founders who don't even have a pitch deck yet and invest in the founders themselves rather than the startup. So to all the founders out there, what are some advice that you could give, maybe common pitfalls, particularly in the biotech space? Anything you can speak to in that sense? Yeah,
I mean, as a fellow, I don't know if I can give too much advice, but I think, as you said, age1, I mean, we are, I should mention this at the beginning, pre-seed, seed stage, super early stage. We want to get, talent, as soon as, you have an idea, we want to help you incubate it. We want to help you bring it to life. And I think, maybe one pitfall, I would say, for founders, right, is, finding the VC fund that matches you, kind of, right? So, there are funds that, are only, Series A through Series C, right? Yeah. If you only have a butt of an idea, you don't, pitch to them, right? I think that age1, we are very founder focused, and so also thinking about the VCs you want to talk to. And I think, I mean, yes, we will look at an idea before a pitch deck, but I think a pitch deck is important as something that you do want to get to kind of have a narrative to your idea, right? I think that's something really important. Sometimes we'll see that founders not really have a story to their idea, or kind of a clear picture of what this idea would look like, and how they would build it out, and kind of a very clear thesis to the company. I think that's something that age1 really any investor would look for. I would say having a very explicit mission and narrative to your company is a big deal.
Great. And just to finish things off, I mean, you've given us a lot here today. Is there any advice you would say could be related to startups, related to VC, related to biotech, or just anything in general, any lessons that you've came away with, or any piece of wisdom that you've carried with yourself that you felt has helped you a lot? You can take your time on this one. Or maybe anything that you've heard from anyone else that's really stuck with you.
I've heard from anyone else that's really stuck with me. I think the biggest thing that I've learned from age1 and people there has to do with what's called self-limiting beliefs. And I think that's something that in my life, I didn't realize how much I was believing in them until I kind of took a very hard look at my life and kind of realized where in, throughout high school and just throughout the ways that I was thinking about my career and my path in life, that I had these kind of constraints or kind of borders around certain ambitions that I was I can't dream that far. That's just not realistic. And I think if I've learned anything from age1, it's that's just, not a true, you just always have to shoot your shot, make your voice heard. And other people will tell you kind of if you're aren't cut out for something, or if something is not realistic. But to do that to yourself is truly a real tragedy. If you limit yourself from achieving the things you want to achieve rather than, the world, right? That's kind of a different story. if you like are doing everything in your power to achieve your dreams, like that's what, like to not have any of those self-limiting beliefs, right? To not let your own ideas about, like what the world might expect from you or what, might be like appropriate constrain you from, putting your ambition and your kind of your impact out in the world.
Yeah, that really does make a lot of sense. I mean, having your conviction in yourself and the confidence in yourself really is the first step to achieving things that you really want to achieve. Thank you so much. Finally, is there anything else that you want to say or anything you want to plug in particular?
Yes. So for anyone who is interested in aging biotech, in aging biology, in VC, biotech, etc., Fred and I are launching the Yale Longevity Initiative, or YLI, on campus this year. It's a real passion project and something we've been thinking about and has been in the works for a long time. Kind of modeled off of similar organizations at other institutions. But we really want this to be kind of an undergraduate focus, but of course, welcome to School of Management, School of Medicine, PhD students, etc. But a space to actually look at research in longevity biotech and be able to have students contribute to projects in this space because it's so new and so nascent. Really, there actually is room for undergraduates to directly contribute to the research and to projects, whether it's in the biology of aging, computational biology, economic modeling. Right? I mean, we didn't even get into these questions, but what happens to Social Security when we, have a longer average lifespan in America? What happens to, the age of retirement, right? So answering those questions. A big part of the organization will be having speakers come in. So founders, VCs, those who have really invested their lives into the space and can, share with students, what does that look like? And yeah, really just exposing students to the opportunities out there in this field. And most importantly, making clear that this isn't just some niche field anymore, that it's not fringe science, that this is a legitimate field with researchers at Yale, having huge budget to work on in this space, and that it really is the future. This idea of preventative medicine and, therapeutics, not just for, sick care, but for health. I think that really is the next wave of medicine. And so if anyone wants to join us, Yale Longevity Initiative, and my email will be somewhere in the description if you're interested. But yeah.
Yeah, great to hear. And thank you so much again for joining us today.
Thank you.